Hello, hello.
Hey,
Yes, we are going to start promptly because we have so much material and I don't want to hold nobody else.
I'm a little behind on the class, but not much.
Okay. When you say behind, tell me, are you
Unit two, just mostly not the quiz, the other one.
okay.
That's about it. But
The
I'm just,
activities you still need to do?
yeah, I'm gonna finish it up. It's not hard. It's just that been I've been working a lot, so.
Okay, I understand.
But I'll finish it ASAP. Like that's nothing. That's not too much. It's just I was reading up on it, and then I got caught up in the reading and extra and learning
Okay.
other stuff.
All right. You did the quizzes though?
I didn't. I'm gonna go ahead and finish that. That's simple. So, and I answered. I got the answers and I studied it also. So it's cool.
Okay. Just I wanted you all to make sure that you know that this is like also reference material so you can always come back to it and you don't have to feel like you have to like know all the definitions and everything all at once. We're like a work in progress, okay?
Yes. Oh, hi everyone.
Hello.
Mhm.
All right. So I have you all can see my screen, Sharon. You see the
Yes.
university up there?
Yes.
Okay, we are going to go to Unit 3, which is Sexual and Reproductive Anatomy and Physiology. I'm going to put on my glasses. Hmm. Okay. Okay. And if someone would just kind of keep up with the chat while I'm reading in case there's something that needs to be brought to my attention, because I'd like for everybody to go on mute and then only when we're doing, when you need to say something or respond or something like that, then to just unmute. That way, those who are listening to the YouTube later, it's a clean copy. Okay, so don't take offense. I do want interaction. Okay, just so that we'll have the background noise out. But if someone is communicating or needing to get in or need help, if you all could just kind of monitor the chat and help out, I'd appreciate that so that I can continue on.
Okay.
Thank you. Little teamwork here. So in this unit, we are going to go over the anatomy, and the first section and unit 3 is the vulva. Okay. Okay, so our sexuality is experienced in many dimensions. Probably one of the most obvious is the physical dimension. It is through our bodies that we experience sensuality, physical stimulation, and contact with others. There are also somewhat predictable psychological responses associated with sexual arousal, including blood flow to the genitals, vaginal lubrication, and erectile response. So our bodies have the capacity for fertility and to potentially create new life. For females, this capacity extends to the potential for pregnancy, gestation, and birth. Understanding the parts and functions of the sexual and reproductive systems is essential in promoting sexual health for yourself and others. So as we go through the vulva, probably the most common mistake people make about female anatomy has to do with the external genitals. Many people mistakenly refer to the external genitalia of a female as the vagina. Though commonly used, this is exactly incorrect. So the external genitals for female are collectively called the vulva. Word vulva refers to several parts of a woman's genitals, including her clitoris, the vaginal opening, the labia majora, which is the outer lip, vaginal lips, and the labia minora, the inner vaginal lips. So there's one standard vulva. They all look a little different from each other. So there's no one standard, excuse me. They all look a little different from each other. I love this diagram down here with all the many colors and shapes. So the vagina is also known as the birth canal. It is the internal organ, a muscular canal of sorts. Externally, only the vaginal opening is visible and the vagina itself is not. There is tremendous variation in how the vulva looks. Vulvas vary in several ways, including the size and shape of the labia, the glans clitoris, and the clitoral hood, the color of the various vulva parts, the distance between the components of the vulva, and the texture, the amount and placement of the pubic hair. So author, educator, and activist Betty Dodson has for years been demonstrating through her work the diversity of vulvas. In her book, Sex for One, in 1987, there were vulva drawings that speak to the variation from woman to woman. The vulvas below are from an art project we worked on with Aaron Toby, featuring a diverse group of vulvas, varying in terms of labia size and shape, clitoral size and shape, pubic hair, and so on. Can you all appreciate the art there? So many women have rarely seen other vulvas and may not have even ever looked closely at their own. Many sexual health promotion professionals encourage women to look at their own genitals, perhaps using a mirror for ease of viewing, so that they can become familiar with and comfortable with what is normal for them. After all, there's no one standard vulva. A woman's attitude towards her genitals is likely to reflect her general self-concept and early childhood message rather than the actual appearance of her vulva. Now, letting women know that vulva parts come in all sorts of shapes and sizes, especially the labia minora, which may be quite small or quite large and are usually not symmetrical, can help a woman to feel more comfortable with her own body. When a woman feels more accepting of her body, including the way her genitals look, she may feel more relaxed during sex. So some research has found that women who have positive genital self-image find it easier to orgasm and more likely to masturbate or use a vibrator, and are more likely to engage in sexual health promoting behaviors such as genital self-examination and annual gynecological exams. And that's according to researchers Herbenek Reese and Herbenek of 2010. So we feel it's important too to note that although most people with vulvas identify as women, not all do. Some people with vulvas identify as men. They may be transgender men, and others may identify as agender, not having a gender or not identifying with gender binary, or as gender non-binary. Also, some transgender women may have a vulva and a vagina created through gender-affirming surgeries. So individuals who have had a vulva and vagina surgically created may find it helpful to use extra lubricant for vulva and vaginal sex play. They may also find it helpful or medically necessary depending on their physician's recommendations. Now, to use vaginal dilators or dildos to help keep the vagina opening open and flexible. Many postmenopausal women also find it helpful to continue to have vaginal penetration, either with a partner who has a penis or through using dildos or insertable vibrators. So if you aren't sure about a client's desire or needs, you can ask them. No one can be an expert in everything. And once again, it's okay to say, I don't know, to questions you are not equipped to answer. It's also a pretty terrific opportunity to learn from those around us. So to read the fascinating accounts of trans individuals connecting with their evolving bodies, you might enjoy reading the book Queer Sex by Juno. So we have parts of the vulva. The vulva includes the following parts. We have the mons pubis, which is the most visible part of the vulva. It is a triangular raised layer of fatty tissue located over the pubic bone. Above the labia and the clitoris, its natural state. It is often covered with pubic hair after puberty, and some people trim or remove some or all of the pubic hair on the mons. Others let it go completely natural. In the postmenopausal period, hair on the mons starts to thin out considerably. So for those that can see, I am going to just show a visual that I use for some of my demonstrations. We don't have to necessarily stop, but if it helps that you have the visual here. So the mons is the top up here, the part that we're shaving, okay? The part that we use our coochie conditioning cream for, okay? Up this area. So then we're gonna talk about the labia majora. This term means the major lips. So it's gonna be the fat part right here, all right? This term means major lips. People also sometimes refer to the labia majora as the outer lips. Since they are not always bigger than the labia minora, they are the folds of skin and tissue that extend along the sides of the vulva from the mons pubis down to the perineum. Okay, the more delicate organs beneath them may be sensitive to touch. So unless a person chooses to remove their pubic hair, the outside parts of the labia majora are typically covered in pubic hair after puberty. So then you have your labia minora. This term means the minor lips, but are often called the inner lips. So you see the pink here? So they may be bigger or smaller than the labia majora. They may look smooth or gathered or wrinkly, and they may be quite sensitive to touch. Unlike the labia majora, the labia minora do not have any pubic hair on them. As with many body parts, the size, shape, and color of the labia minora vary greatly from person to person. The clitoris. The clitoris is a high, nerve-rich, and thus sensitive part of the vulva. The clitoris functions only as a source of potential pleasure. It is located in the folds of the vulva where the top of the labia meet. Externally, the clitoral hood, you see here, and the glands are visible. The hood covers the glands. Inside the body is the clitoral shaft, which extends from the glands to the pubic bone. And the clitoral or crura, which are the two branches of the clitoris. And let me see. I don't have that one out. I wanted to show you the shape for it, but it's okay. All right, so the clitoris, the nerves extend about 3 inches on either side of the vagina, and during sexual arousal, the glands or the shaft become engorged and filled up with blood and expand. Because of a woman's clitoris expands in this way during sexual arousal, it is currently thought that the clitoris is involved in most, if not all, experiences of female orgasm. So whether or not a woman's clitoris is directly stimulated during sexual activity, in 2017, a study published in the Journal of Sex and Marital Therapy, we found that 2/3 of women liked direct stimulation of their clitoris, but many other women prefer to be touched near the clitoris, but not directly on it. We also found that 5% of women in our study prefer to avoid direct clitoral stimulation entirely. So they have a nice diagram there. If you're not familiar, make yourself familiar, maybe even make a copy or something so that you can have accessible for referral, okay? So now we'll go into the vaginal opening. So the vaginal opening is the entranceway of the vaginal canal. So we have the opening through here. This is the area that's typically sensitive to touch, pressure, and sensation. It is located at the bottom ends of the folds of the labia. This opening is covered by the hymen during childhood. The hymen may not be torn or punctured through normal exercise, tampon use, masturbation, or other common activities that occur during childhood. Although it may look small, the vaginal opening has tremendous capacity for expansion, such as during intercourse or more dramatically during the process of vaginal birth. So the urethra opening. So here you would see the urethra opening would be here. That is the tube that extends from the bladder to the urethra opening. Some healthcare providers suggest that wiping after urination should be from the front of the body towards the back to avoid getting bacteria near the urethra opening, thus decreasing the risk for potential urinary tract infections. So if someone is very prone to UTIs, they may also find it helpful to urinate after intercourse, empty their bladder completely when they're urinating, avoid using scented hygiene products, take showers rather than baths, drink plenty of water, avoid tight-fitting synthetic underwear. Then we also have the perineum. The perineum is located between the vagina openings and the anus. It's that little space that we have just below where the labia majora meet at the bottom. So it is highly saturated with nerve ending and is very sensitive. Now, in preparation for vaginal childbirth, the perineum is often massaged to make it more flexible and to minimize tearing. An episiotomy is a surgical procedure that cuts the perineum to allow for passage of the baby's head and shoulders. Though an episiotomy is sometimes medically recommended, other times healthcare providers suggest that natural tears may heal more easily than episiotomy cuts. Women who have questions or concerns about planning for childbirth should be directed to their gynecologist or other healthcare providers. You have your anus. The anus is the opening to the rectum, and the anal opening is a highly sensitive area and may be sexually responsive to manual or hand fingering stimulation or penetration. So in the third section, we're going to go over the female internal sexual and reproductive parts. So now you have the vagina, the flexible muscular canal that is approximately 3 to 4 inches long when one is not aroused. It extends from the vaginal opening at the vulva to the cervix. During sexual arousal, the vaginal walls secrete a clear, slick fluid along its length. The lower 1/3 of the vagina, closest to the opening, is often the most sensitive to sensation. The vagina has great capacity to stretch, and as is the case during vaginal intercourse, and much more so during vaginal birth. Please know that this stretching process is called tenting. It is not in this unit, but you have to go through some steps or stages in order for the vagina to stretch and open properly. So it can be stretched abruptly, which does cause sometimes discomfort. It can cause the micro tears, and through the arousal process, if you allow the blood flow to increase to the clitoris and labia first, then the next step, the body will get the signal to go ahead and let the vaginal walls extend and go through the tenting process. So a lot of times when people don't do foreplay, then they have a little more discomfort when they have intercourse. And that's the reason why, because the walls didn't have a chance to secrete that fluid and open up like they should. G-spot. The G-spot is also known as, the formal name for it is the Gaffenberg spot. It remains a controversial topic in sexuality research. Some sexual health experts describe the area as being located about 1 to 2 inches inside the vagina on the other side of the front vaginal wall. So let me help you with a visual for that, because even though we're reading that, I don't know if you're seeing that, okay? So if we use the puppet here, the clitoral hood should be back because maybe you're going through the arousal process, so it wouldn't be down so much. But if you are laying down on your back and you take your 2 fingers and insert and push upward, this is where the G-spot is located. So about 1 to 2 inches inside the vagina and on the other side of the front vaginal wall. Okay, so think about it. You got the clitoris and all the nerves that come down behind here, and then the G-spot pressing upwards. So the first 2 inches of your vaginal entry and the clitoris is where all the nerves and all the sensitivities are. Okay, but because it's not something that we can directly see or touch, some suggest gently but firmly stimulating this area with one's fingers, a sex toy, or a partner's penis to see how it feels. So if you put your fingers up there or put something there, you should be able to press and feel that it's something there. Some women find it highly stimulating when pressure is applied to the G-spot. Also, some women have the capacity to have ejaculatory responses, also known as squirting, in which a clear fluid is ejaculated during sexual arousal or orgasm. Often in connection with the G-spot stimulation, relatively little is known about why some people experience this capacity while others apparently do not. Our G-spot, our GPS enhancement product, this is what helps people locate that G-spot. So if you haven't located it before, sometimes using an enhancement cream can help you find it. So that tingle in that cream that they've designed is going to help make your G-spot actually come find you. It'll make it swell. It'll make that increased blood flow come there. It'll make it kind of pop out and say, hello, here I am. You don't have to look real far. I'm right here. And so that's what that enhancement cream is for. So for people who might not even have a lot of sensitivity there, sometimes it's through the way they're made up, sometimes it's medication. It's a lot of different factors. However, if they need a little help, again, knowing where to find the spot, discovering where their fingers or toys or penis works best, and then finding out whether they need enhancement creams and or enough lubricant to get to that point. Okay, here we go. Fallopian tubes, ovaries, cervix, uterus. Okay, so there's a diagram, but I'm going to move the screen in order to read, or I could leave the diagram up and read from my notes. Hold on. Well, it's okay. I just wanted y'all to be able to look at it while I was reading it, but it's okay. Let's go to the cervix. So you see the cervix is here, right? So these are your vaginal walls, right? That extend and open up. And then you have your cervix that is right here, okay? The cervix is located at the end of the vagina and connects to the uterus. It is the opening of in the cervix, which is normally the diameter of a pencil lead. So very, very, very small, right? It dilates a small amount during menstruation and has to as much as 10 centimeters in diameter in childbirth. So it goes from that pencil lead to 10 centimeters, just so something can come out of there, right? Cervical cancer screening is conducted using a regular Pap test. As of this writing, U.S. Guidelines recommend that Pap tests every 3 years for women ages of 21 to 29 years and 5 years of age for women 30 to 65, along with an HPV test. All right. There's also several HPV vaccines available, and they have been approved. We're going to move on to the uterus. The uterus, also called the womb. So looking at the diagram, you have your vaginal wall and your canal. Then you have the cervix, And then right above that, you have your uterus that is held by the two sides where the fallopian tubes are. So the uterus is kind of tacked up. So when people have a prolapse uterus, that means that those 2 points at the top that are stretchy like this, that they've dropped down, or they're no longer attached like they should be. So it's like the elasticity has fallen, and then that makes that uterus start falling through into the vaginal canal. So the womb, the uterus, is where a fertilized egg would implant to initiate the process of pregnancy. The uterus is a muscular and flexible. Normally, the uterus is the size and shape of a small pear, and during pregnancy, it expands to accommodate a growth of a fetus or even multiples. The lining, called the endometrium, thickens with extra layers of blood and tissue to nourish the fertilized egg. If fertilization does not occur, the extra lining is shed as the menstrual fluid, and endometriosis is a serious, so then you have endometriosis. There's a serious health condition where the endometrial cells grow outside the uterus and can cause discomfort or pain. Then you have the fallopian tubes. These run from the top of the uterus to the ovaries. They're about 4 inches long in diameter of the needle at the connecting point with the uterus. They expand to the width of a cooked spaghetti for the most of the length and widen at the opening near the ovaries. This end contains tendrils and fingers called fimbriae that float next to and drape over the ovaries rather than connect to them. The fimbriae direct the ovum or egg into the fallopian tube upon release from the ovary, and when the fertilization occurs, it usually takes place in the fallopian tube. So if you look at the diagram, these two work closely together, okay? Hold on. Ovaries, or the female gonads, are sex organs that produce reproductive cells. About 400,000 immature ova or eggs are present in ovaries at birth. Initiated by hormonal changes at puberty, an ovum matures and is released approximately once a month for about 40 years. This clearly females are born with far more ova beyond what could be used. The ovaries also produce the hormones estrogen and progesterone, which are responsible for the pubertal changes in females, including those in the breast, the vagina, and uterus. These hormones can also play an important role in a woman's fertility cycle. So the breast, we won't spend a lot of time on this. Yep, this is a short unit. So the breast can be, shoot. I don't know how to close this. Hold on one second. All right. So the breasts are sexual organs for people of all genders. They can have a role in nourishing an offspring for those who choose to breastfeed or chest feed. The size and shape of the breast and size and color and shape of the areola and nipples vary greatly. Some nipples protrude inward and are known as inverted nipples. The areola is the area around the nipple that is usually a darker color than the rest of the breast. Breast can be a source of much erotic pleasure for people of all genders who may feel sexually aroused by stimulating the breast and nipples. However, in spite of cultural focus on the nipple, the tops and bottoms and sides of the breast are actually even more sensitive to touch than are the nipple and areola. Women may find it helpful to explore breast touching alone or with a partner to learn more about what feels good to them. Menstruation. Menstruation begins with menarche, which is the female's body signal to begin ovulation each month. This typically occurs for the first time at the age between the ages of 10 and 16. Menstrual fluids is made up of the blood and tissue which had comprised the thickened walls of the uterus. It is passed through the cervix and the vagina. This flow is called having a period. The menstrual cycle creates the conditions to allow for fertility and pregnancy to occur. The cycle is less regular when it begins at puberty and it ends at menopause. So a woman's menstrual cycle corresponds to her fertility cycle. The menstrual cycle starts on the first day of a woman's period. The average cycle lasts 28 days, but can vary from 23 to 35 days. Fluctuating levels of hormones can cause the change of the cycle. These hormones include estrogen, progesterone, follicle stimulating hormone, FSH, luteinizing hormone, LH. And during the first half of the cycle, the follicular phase levels of estrogen rise and cause the lining of the uterus to thicken. FH causes an ovum to mature. About halfway through the cycle, the surge of the LH causes ovulation and the ova is released into the fallopian tubes. So during the second half of the cycle, the luteal phase, the ovum travels through the fallopian tubes to the uterus. The progesterone levels rise and help prepare the uterine lining for pregnancy. And if an egg is fertilized by a sperm, usually by the fallopian tube, the fertilized egg implants in the uterine lining and a pregnancy begins. When pregnancy does not occur, the egg continues to travel down the fallopian tube, estrogen and progesterone levels drop, and the thickened uterine lining is shed along the ovum and a menstrual fluid or the next period. To learn more details about a woman's menstrual cycle, please visit Planned Parenthood. So with the hormones that were named here, you could see why fertility has so many moving parts and how hormones play a part in it, a heavy role in it, because you have that estrogen, the progesterone, the FSH, and the LH, and they all got to work together at the right time. And so this will come up as you work with clients, and it may be even a reality for yourself. But this is why that part can be so complicated and, easier for some and not so much for others. So be sensitive to it more so. We're listening to somebody's TV. Let's see. Okay, so many couples do continue to engage in sexual acts during menstruation, where others may abstain. Despite traditional attitudes that associate menstruation with uncleanliness, there is no scientific evidence that sexual intercourse is harmful to either partner during menstruation. There are various reasons that people abstain, such as religious prohibitions and the messiness of the flow or lack of comfort with a partner. Now the fun part, let's do the male genitals and reproductive parts. Men have an advantage of having easier access visually to their own genitals, as well as how the genitals of other men look. More opportunities are available to men to see other men through everyday bathroom and locker room interactions. This allows for comparison, confirmation about variations about how genitals can look. Unfortunately, it is sometimes the case that these comparisons result in some men feeling bad about themselves.
They want to come in here? Hey,
Hold on.
want to come in here?
That is Miss Allen. Got it. Okay, so culturally, there's a lot of emphasis on valuing a large penis over a smaller one. In fact, while there's a large amount of variation in size of flaccid penises, much of the size differences are eliminated when comparing erect penises. Penis size can vary quite a bit in both a flaccid and erect state, and no size is necessarily better or more or less likely to be pleasurable to a partner than other sizes. Interestingly, research on women perspectives of importance of penis size conducted in 2006 found that girth was perceived as more important than length, then only 12.8% judge girth and length important, whereas 21.8% of the respondents reported that they found both girth and length unimportant. More experienced women tend to judge penis size more important in terms of both girth and length. Overall, it doesn't seem that the penis size is universally important to women's satisfaction with the sexual experience. Less is understood about how male partners and men perceive penis size in terms of sexual satisfaction. So the male external sex organs include, now let me see. We should have the diagram up, but it's okay. The penis, the primary sex organ for males. The penis allows both semen and urine to pass from the body through the urethra. Penises vary a great deal in size and appearance. Parts of the penis include, we have the shaft, the glans or the head, the corona or the ridge, you have the foreskin, and the frenulum. So you see the parts, that didn't label all of them. The corona is called the rim or the trim here. That's not on here, but you have the glans penis, you see the shaft, and the frenulum is like that vein that goes down, okay? Surgery to remove the foreskin is called circumcision and sometimes referred to as male genital cutting. So inside the penis are three spongy cavernous tubes, two that run along the top of the corpora of cavernosa. The corpus sponginosum runs along the underside and surrounds the urethra. When aroused sexually, these tubes become engorged with blood and cause the penis to become erect. The penis does not contain any bones. Scrotum, a pouch of skin that is divided into two sections or sac to hold the testes. The scrotum has two muscles that tighten and relax to move them, and the testicles up and down in an effort to keep testicular temperature constant. Now, small muscles on each of the spermatic cords move the testicles up and down. When the man is hot, the muscles relax and the scrotum or the testes hang lower to cool them. If he is cold, the scrotum becomes tight and pull these testes closer to the body for warmth. Another muscle in the walls of the scrotum pulls the skin taut to increase warmth or relaxes to create wrinkles, and more air to skin surface for cooling. That is located inside the scrotum. The following are also located outside the body, and externally are the testicles or the gonads or the glands that produce reproductive cells. They float loosely in the scrotal sac and produce sperm cells and secrete testosterone. Sperm cells are continually formed in the seminiferous tubulus here throughout a man's life. These microscopic tubes are tightly compacted and would stretch 1,000 feet if were possible. Monthly testicular self-exams are important health screenings that should be started at the age of 15. Check for swelling, lumps, and changes, and see a physician if irregularities are detected. So the epididymis is also attached to the back of each testicle and connects it to the vas deferens. It is where the sperm cells mature prior to ejaculation. Sperm cells mature in about 70 days, and those that are not ejaculated are safely reabsorbed into his body. And we'll look at a diagram on the next page as well. Then you have the anus, an area rich in nerve endings. As discussed above, the anus and the perineum are very sensitive areas that many people enjoy having stimulated. Men of all sexual identities, orientations may enjoy having their anus stimulated and or penetrated. However, as with any other sexual behaviors, men's partners should talk with them first to see if they want to explore anal stimulation rather than to just spring it on them. Consent is key for people of all genders. All right, so the internal male productive parts. So we talked about the vas deferens. So that is the tube connecting each epididymis or testicle to the seminal vesicle. Sperm cells travel through the vas deferens during sexual arousal to prepare for ejaculation. So a vasectomy is a permanent form of fertility and control in which the two of the vas deferens is severed and sealed to prevent sperm from being ejaculated. The man would still ejaculate semen since that fluid is produced in the seminal vesicle glands. So there is a diagram here to give you an idea about the testes and the vas deferens and where their placement is. Okay. Prostate gland. That gland produces a thick fluid that comprises mostly of the remainder of seminal fluid. This prostatic fluid helps to maintain a pH level in the vagina that is hospitable to sperm viability. So the urethra runs through the prostate and connects with an ejaculatory duct here. During sexual arousal at a point near ejaculation, the prostate contracts and shuts off the part of the urethra that extend from the bladder so that urine and semen are not passed at the same time. As men age, many experience enlargement of the prostate, which can affect urination. Now, regular screenings for prostate cancer are more often recommended for men beginning between the ages of 40 and 50, depending on family history. Men should be advised to have annual wellness appointments with their healthcare provider and to ask their healthcare provider any questions they may have about prostate health. So you have a diagram here. We'll talk about the urethral bulb, a portion of the urethra surrounded by the prostate where the semen gathers until ejaculatory inevitability. When muscle contractions force the semen through the urethra and ejaculate it out. This is a distinct difference between male and female sexuality. Though men reach a point where they will physically ejaculate no matter what happens, this does not always happen with women. Many women find that even when they feel highly aroused or close to an orgasm, it is possible that they may suddenly find it difficult to orgasm, perhaps because the sensation starts to feel less pleasurable or because they feel distracted, unhappy, or turned off for some reason. Then you have the Cowper's gland. It is located on each side of the urethra. I need some water, y'all. Are located on each side of the urethra below the prostate gland. They secrete a small amount of fluid that mixes with semen and contribute to pre-ejaculation. This is sometimes called pre-cum, which is a clear fluid that many, but not all men emit noticeable amounts of during sexual arousal. Some STIs, including HIV, can be transmitted from an infected man from this particular fluid coming from the Cowper's gland, that pre-cum. All right, the fun part. Let's talk about erogenous zones. Erogenous zones are areas of the body that are especially sensitive, sometimes referred to the genitals or the body parts that are most sensitive, or what we commonly associated with sexual activity as primary erogenous zones. So primary and secondary is not the same for every person, okay? So you have the clitoris, the labia, the penis, the scrotum, the anus, the breast, and the nipples. Those are considered the primary erogenous zones. And then you have the mouth. They're highly saturated with nerve endings. Now, these and other body parts can be pleasurable to touch or stimulate. What is considered to be arousing and pleasurable is highly individualized and experiential. Something that feels good to one person may not to another. Touch that sometimes feels good doesn't always feel good, even to the same person and from the same person. It's a time and a place for everything. Therefore, communication with a partner is incredibly important for achieving sexual pleasure. Whatever body parts and spots qualify as primary for anyone, most can agree the rest of the whole body then can make up as secondary. So this is at least potentially true. If one has an erotophilic or sex positive perspective with regard to this aspect of personal sensuality, using lotions and oils to massage the skin and lubricate the genitals can greatly enhance sexual interaction. When using latex condoms to reduce risk, be sure to use only water-based products, as other products may break down the latex, making the product less effective. We've heard that about not using silicone-based lubricants when using latex condoms, right? So we want to make sure that we are keen to that when recommending something for lubricants to our clients, okay? And that part where it talks about using lotions and oils to massage the skin can greatly enhance sexual interaction. That's that skin to skin contact. And more women than men need that skin to skin contact. That is a major component for women to completely go through their arousal point. It doesn't always have to be the shoulder or arm or neck, but there's some type of skin to skin contact that needs to happen, and for us to really connect well. And that's most women. Kegel exercises may be beneficial for both men and women. Kegels are done by contracting the muscles of the genital area as if to stop the flow of urine. Exercise programs that include squeezing and relaxing the muscles repeatedly and daily can enhance sexual well-being. Some women describe greater genital sensitivity, and men report increased sensitivity and ejaculatory control, as well as stronger orgasms from performing regular Kegel exercises. Kegel exercises can also help women have fewer problems with incontinence or losing urine without meaning to, which can be particularly helpful after having a baby. So ladies, you may want to study a little bit more about Kegels and when they are appropriate. We do have several products that are great for the great for exercising the vaginal walls and those muscles down there. Kegel muscles are great, but sometimes women need pelvic floor therapy. If you have someone who's struggling with incontinence, have them ask their gynecologist to take a closer look and actually ask for pelvic floor therapy. If you've never heard of it, it is sometimes the physicians are not offering it. However, between childbirth, being overweight, different things can cause your muscles to be imbalanced down there. And so sometimes Kegels are just tightening, and the muscles are too tight down there. And so they do not contract and release. They don't contract and release when they should. So pelvic floor therapy creates that positive balance.
Did you say pelvic floor?
Yes, pelvic floor therapy.
There is such a thing to where they can be too tight.
Speak up.
I said there is such a thing as to where your muscles and your uterus can be too tight. That's the first thing.
Yes. So you know how we were looking at the diagram of the vaginal wall, the cervix, and the uterus? Um,
Yeah.
your muscles there actually hold all those organs in place. And when the muscles aren't working well, or because that uterus may be prolapsed, there's a few different conditions that would make the muscles not be able to do their job. So it could place more pressure on your bladder than it should, because maybe your uterus is sitting on it, or it's leaning to the right or leaning to the left. So what happens is your muscles contract and release to hold your bladder and your uterus in place. So if it's always contracted, then when does it release and grab and contract again to hold something in place? It's just taut. It's just really tight. So then it's not holding anything. It's not supporting the other organs.
Right.
And
I
so,
also,
oh, go ahead.
oh, sorry. I was looking at Google, and I think Google had said that planks also help with your muscles. I guess your I guess those muscles, the uterus muscles.
So, okay, so the reason why pelvic floor therapy is really, really good is because there's an assessment that they do. So a gynecologist would do an actual assessment, and they can tell you, they'll know, because they know all the muscular anatomy and everything, they'll be able to tell which muscles are tight versus which ones are loose. And when they send you a referral to get pelvic floor therapy, then that therapist knows that you need planks, or you need this, or you need that. So you can do those exercises on the internet, but when you go to a physician that's trained, they're actually going to give you a plan that's specific to you.
Right.
Yep.
Okay.
To me, I call it the most best kept secret from moms, because I have 6 children. I didn't find out about it till way later.
Right. Right.
Could have been getting it all along. It doesn't take much to
Exactly.
qualify, and
They tell you
even
that right away.
no, they don't. They
They
should.
don't even tell you that when you have your babies. They don't even suggest that. Well, they didn't to
No.
me. I guess.
Yep. Yep. So that's why we're here. We're going to help educate. Say, have you asked your physician? Okay, so we've made it through unit 3 content. Now remember, we have to do the activities. Activity 1 says what you learned from your parents or school. Think about your own family conversations or school-based sexual health education growing up. What did you learn about the vulva and the vagina, or the penis and the scrotum? How did what you learned from your parents or school shape how you understand or think about the genital parts? In what ways do you feel your work as a sexual health professional can be used to help others feel positively about their bodies and their partners? There's no right or wrong answer. Type it in. Then you want to make sure you hit save my answer. Okay. And then you're all done. You go to the quiz. Y'all ready to do the quiz? Woo, 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 woo.
Yep.
All right. So breast cancer is the most common type of cancer in the world. Is that true or false?
True.
That is very true. All right. It is also one of the more frequently diagnosed types of cancer in women. Okay. 2, male genital circumcision is rare in the United States. True or false?
False.
That's false. All right. That is correct. All right. 3, engaging in sexual activity during menstruation can help with management of menstrual cramps. True or false?
True.
It
True.
is very true. Even in spite of some people's beliefs or differences, it does help with cramps. They have found that
Very myth.
much. 4, blank. The blank is the name of the external female genitals, where blank is the name of the internal structure of the female genitals.
Vulva and
Vulva
vagina.
and vagina.
Right. Vulva is the external and vagina is the internal. So let me make sure I select the right one, y'all. Okay, there we go. All right, please match the definition provided below with the correct term. Ovaries. What are the ovaries? Is it an area located about 1 to 2 inches along the front wall, vaginal wall? Is it located between the vaginal opening and the anus? Is it the female gonads or sex organs that produce reproductive cells? Or is it the location that the fertilized egg would implant?
The last one.
The location that he fertilized.
Fertilized egg with implant.
The last one. Yeah.
Okay. The last one, the location that a fertilized egg would implant. All righty. Let me just double check.
Yeah, that's the one I chose.
It is 3.
Mm-hmm.
It is the female gonads or the sex organs that produce the reproductive cells. The location that the fertilized egg would implant was the fallopian tubes.
Right.
Mhm. Trust me, I'm a work in progress too, but when in doubt, I go look it up. Please match the definition provided below with the correct term G-spot. Is it the area located 1 to 2 inches along the front vaginal wall? Some women find it highly stimulating. Is it located between the vaginal opening and the anus? Is it the female gonads or the sex organs that we just called the ovaries? Is it the location that the fertilized egg would implant that we call the fallopian tube? So which are the first two?
The first one. The first one.
Yes, 1 to 2 inches along that. See, if you remember those 2 fingers, I'll be like right there. That's that G-spot. All right, please match the definition provided below with the correct term uterus. So the area located about 1 to 2 inches along the front vaginal wall, we've already identified, right? So process elimination. Is it located between the vaginal opening and the anus? That would be the perineum. The female gonads or sex organs that produce productive cells, we just defined as ovaries. And then the location that the fertilized egg would implant is the
That's
uterus.
the fallopian tube.
Okay, so we got 7 is the location that the fertilized egg would implant.
Egg would implant, right.
Because that's where it's held.
Mhm. All right. 8, please match the correct definition of the following terms: testicles. Is it the tube connecting each epididymis and testicle to the seminal vesicles? Or sperm cells travel through this tube? Is it the gonads or glands that produce reproductive cells? It's a typo. Or is it a very sensitive area on the underside of the base of the glands, the penis? Or is it the glands located at the end of each vas deferens?
Gonad.
Don't you come on saying no dads.
I've been running, so
The
Gonad.
Let me read the
the
test.
gonads and glands.
out her clothes clean and then wash it.
Yes. The gonads and glands that supposed to say, it says product reproductive cells supposed to be produced.
Deuce, yeah.
Can you give me some water, please? Thank you. Go get him some water and get me some, please. Thank you. All right, 9, please match the correct definition to the following terms. Vas deferens. The tube connecting each epididymis and testicle to the seminal vesicles. Is it
Yes.
the gonads, the very sensitive area, or glands located at the end of each vas deferens?
The first one.
First one.
The first one.
Yep,
The
you're
two
right.
connecting each epididymis. Yeah.
All right, 10, which of the following is not a common menstrual problem? Is it dysmenorrhea, menopause, premenstrual syndrome, or amenorrhea?
Menopause.
Menopause.
Yes. Trick question, right? They was trying to flip you around and be like, okay, menopause when you ain't got it going on, right? It ain't there no more. All right, 11. Which of the following is not a tactic to prevent a bladder infection or UTI? Which is not a tactic? Increased use of alcohol and caffeine, washing hands prior to masturbation, drinking lots of water, or preventing objects that have touched the anus from subsequently touching the vulva.
2.
Increased use of alcohol and
Increased use of alcohol and caffeine. That will not help you prevent it, will it?
Oh,
12,
right
which of the following are not a part of anatomical structure of the penis? They about to get you now, you gotta listen. Now, is it the glands, the corona, the perineum, or the frenulum? Which is not the anatomical structure of the penis?
Perineum.
Yes. Okay. And then we have 13, the portion of the urethra surrounded by the prostate where the semen is gathered. Cowper's gland, urethral bulb, seminal vesicles, or vas deferens.
Cowper's gland.
The vas deferens. No.
I have for 13. So wait,
Or
Cowper's
seminal
gland is gonna be
No.
your pre-cum.
Mhm.
So it's gonna be your urethral bulb.
Oh,
It's surrounded by the prostate.
Do we
yeah.
have that?
It's gonna be surrounded by the prostate. That's gonna be the urethral bulb.
Wow.
That's why when men have prostate concerns, sometimes when they urinate, it come out like doop doop. It'll have those pauses in between their,
Pulses.
in between when they urinate. Erogenous zones may include which of the following? Inner thighs, nipple, anus, or all the above?
All of the above.
All above.
Why not? All right. The place in the female body where the fertilized egg would implant to initiate the process of pregnancy is?
The uterus.
Yep. That's what's gonna hold that pregnancy.
The womb, right?
Yep, the womb. I know when we were back and we were reading those definitions, I did make the mistake of saying the fallopian tubes, but that's when you have what you call a tubal, like
Baby.
call it
Tubulization.
what do you call it? What's the word?
Topic.
Tubulization.
Ectopic, or a tubal pregnancy. Yep. And that's not what we want. That would be painful. All right, so just scrolling through to verify and show that you that what we went over is correct. When you take it, if you didn't do it alongside with us, you will be able to see if you get something wrong. I love that it will highlight the correct answer. Okay, but it's going to tell you. And so if you want that 100%, all you got to do is go out of this and come back in, and it will reset and allow you to take it again. You want to make sure that you have a score of 80 and above as your score. Like if you get something less in on another unit, just make sure you go back in and retake the test. Don't just say, oh, I got the answer now and leave it. Because it's going to reset, but they need to see when they're grading your completed tasks, they need to see that those units have 80 and above. And so it's going to keep score of your highest and not your lowest. All right. We can go to learning unit 4. Look how far we're getting across through this curriculum. We're doing it, ladies.
We'll make good time too.
Yes, better than last week. I mean, Monday, I was like, oh no, we got to keep good time. Okay, so I'm gonna move my little screen so I can read. Why does it do this? All right, so we are in sexuality across the lifespan. And to me, this is a really fun unit. So it's not difficult at all, okay? It's gonna give you something to think about. So sexuality encompasses much more than just our sexual behaviors and interactions. Who we are and how we experience our world is influenced by our sexuality from birth, and it continues throughout our lives. How others interact with us also impacts our sexuality and how we experience it, as do cultural messages that we receive about sexuality. The messages about bodies and sexuality that we receive as children and as adolescents and as adults can be subtle or explicit. So sexuality as a lifelong process. Using a holistic framework for sexuality encourages a lifespan perspective about being sexual. Remember that our sexuality includes many topics that are important during all life stages, including sexual response and skin hunger, feelings of liking and loving others and sharing trust, gender and biological sex, body parts and functioning, the unfortunate possibility of experiencing sexual exploitation. So all people have emotional and physical aspects of sexuality. Each of these parts of our sexuality is influenced and constantly interact with the environment, which includes the people around us. Sexuality is much more complicated than what happens with people's genitals. Our sexuality is a fundamental part of our biological and social heritage. We are structured, to address a variety of human needs using both biological and emotional aspects of our sexual selves. This includes not only fulfilling the need to maintain the population through procreation, but also addressing basic needs like safety and connectedness. Consider that even something as basic as having a sense of what sexual feelings are acceptable and which are unacceptable is an aspect of our sexual socialization, which can endure for a lifetime. Now, clearly, our sexuality is a part of who we are. Sexuality is a lifelong process activity. So they want us to do an activity here, and using the broadest definition of sexual being, including all of the topics in the circles of sexuality model introduced in Unit 2. Remember, it was the intimacy and sensuality. You guys remember that circle? Okay. Think about each of the stages of development listed below and list 3 sexuality issues or ways that sexuality might be experienced during this stage. So a sample is listed for each of you to get started. So one of the examples, from the age from birth to 3 years old, the example, somebody learns about love and trust through touching and holding. So I put in one of my answers, bathing, learning his or her body parts and having others touch them. Babies get this at birth. You know, they get bathed and they get their diaper changed. So diaper changing requires others to touch and clean their genitals, and they will learn what they like. I don't know what I got down here, something. Like and when, something. All right. They also learn about toys associated with gender, and what family and friends accept and tolerate. So these are activities that you all would have to do. It's 9. They go through 9 stages, okay? 4 to 8, 9 to 11, 12 to 15, 16 to 18, 19 to 30, 31 to 54, 46 to 64, and 65 to death. What do people experience based on those circles of sexuality? How does it change? How does it evolve one way or another? Okay. Of course, acknowledging that people are sexual from birth until death doesn't necessarily mean that people are having sex in order to be sexual. Just by being human, whether we identify as man or woman or as transgender, we exist as a sexual being. By having a body that we and others experience as an entity separate from all others makes us sexual. Even though not all of our interactions with others are sexual, because we exist in relationships to others, even if we are isolated from them, we are sexual beings. Humans would not be alive if not for sexual interaction. Hold on. Okay. All right. So childhood sexual development. It surprises many people to learn that some aspects of sexual development are evident in fetuses even before birth. Consider the following examples: the formation of anatomical sex organs and the brain, chromosomes and hormones, male sexual response, that is, fetuses have erections even while in the womb. So if you've seen that that ultrasound where it's standing right up, you know, there it is. It starts very early, right? Shortly after birth, other signs of sexual development emerge. Research long suggests that female babies, for example, exhibit vaginal lubrication early on, just as male babies experience penile erections. These are normally bodily responses that occur to some extent throughout life. And while every life is unique, there are common problems and pleasures at different points of the development. One of the first ways that sexuality is experienced is through gender identification. Sometimes this happens before a baby is born, when parents learn when they're having a boy or a girl. They may begin preparing their nursery in different ways if they expect to have a boy or girl, and may buy different color clothes or toys. Once a baby's born, people act differently towards babies based on the perception that it is either a baby boy or a baby girl. Throughout their life, there are both subtle and explicit interactions that form each of us about gender identity and related expectations. Very quickly, it becomes impossible to discern the cause of things in terms of nature versus nurture. We can't always tell if a behavior is caused by being a male or female, or if it is caused by being treated as a male or female. From the first moments of life, we are taught to act our gender. During our lifetime, there is a combination of things that impact who and how we are. By the age of 2 or 3, children know whether or not they are a boy or girl, although they do not know their sex is not likely to change during their lifetime. Children this age are beginning to develop attitudes about their body and perhaps naming body parts. Both male and female infants experience a psychological response to pleasure. Parents who touch their infants' genitals while changing or washing them may notice the capacity for sexual response, and they may see this through seeing the infant smile or express excitement. Kinsey and his colleagues were the first to document the capability of infants to experience sexual response that closely resembles an orgasm. They noted that a baby boy shows behaviors that resemble adult orgasm by as early as 5 months. Baby girls as early as 4 months, Orgasmic experiences are similar to that of adults, except for the absence of ejaculation in boys. This does not occur until after puberty. No, they was doing that research back in 1948 and 1953 now. Okay. Young children learn about love and caring through touch and interaction with caregivers. They are especially curious about exploring their own and others' bodies. These lessons are reinforced through caregiving interactions, including during toilet training and bathing. There is much interest and confusion about where babies come from at this age. Most childhood sex play is with some same-sex children and is a very common occurrence. Children often show each other their bodies with games such as "I'll show you mine if you show me yours." This same gender sexual activity can include sex games such as playing doctor and become common between the ages of 6 and 10. Through this exploration, children may touch each other's genitals or masturbate together. These types of childhood games support the thought that sexual behavior that is learned plays a role in preparation for older adolescents and adult sexual interactions. Now, children's knowledge of sex varies widely. In a study conducted by Goldman and Goldman in 1982, they interviewed 813 children in Sweden, Australia, Canada, and the United States and Great Britain. Among 5-year-olds, the researchers found that Swedish children had more accurate knowledge of genital differences and their proper names for genitals than children from other countries. The children from Sweden were also less embarrassed to discuss these issues, and this cultural difference can likely be attributed to the comprehensive sex education that Swedish children receive beginning in kindergarten. As children approach school age, they gain a greater understanding of how nudity and genital touching are reserved for private times and places. They begin to learn about love and marriage and how people express love and caring to others. They may begin to use sexual slang words and are often joyous about the naughtiness involved with that. It is likely that pre-adolescence age children have infatuated patterns with peers or crushes that are similar to those experienced by teenagers and adults. These types of interactions between children, sometimes called social sexual behaviors, are common among children. All right, adolescent sexual development. Change is the key word used to describe sexual issues during adolescence. That's the period between childhood and adulthood. Puberty is a part of adolescence and begins with the appearance of secondary sex characteristics, such as bodily distribution of hair and fat, developmental of muscle mass, deepening of the voice. It marks the onset of fertility. It's the ability to become pregnant or cause pregnancy through ejaculation. Typically, girls are about 2 years ahead of boys in their adolescence development. During adolescence, children often experience a shift in valuing the input of peers, even over that of their family. This shift doesn't happen all at once, or even in a consistent and ongoing way. Puberty may be rough, or it may be experienced as relatively smooth. During adolescence, major growth is happening in 3 important areas: physical changes, brain maturation, and psychosocial development. Let's begin with the physical changes. Physical changes, there's a tremendous variation in what is a normal body size for adolescents. Height spurts can begin to occur for boys at about the age of 13 and for girls around the age of 11. Now, girls might begin to get breast buds around the age of 11, and the average age of beginning menstruation is 12. Boys' testicles and penis grow during ages 12 to 16 typically, and at this point, boys begin to produce sperm, and most boys experience nocturnal emission called wet dreams. The vital importance of sperm production and menses is that they mark the beginning of fertility. Again, there's a great variation. Other physical changes of adolescence include an increase in body hair, changes in the voice. Boys get broader shoulders and girls get wider hips. Younger adolescents especially have concerns about how their bodies compare to others. Sexual response is rapid, and that those in late adolescence and early adulthood have a higher sex drive than other ages. Early ejaculation and lack of orgasm are more common in late adolescence, early adulthood than later in life. Cognitive or brain maturation in adolescence are moving from being limited to concrete thinking. So I want y'all to take note that even though they got those activities for you, they're telling you in this unit all the activities that go along with these particular age groups. So you don't have to try to figure it all out. Hint, hint, make the activity part easy for you. So adolescents are moving from being limited to concrete thinking and toward an increased ability to be capable of abstract thoughts or the ability to conceptualize ideas that may not be associated with anything tangible or that can be seen, touched, or otherwise related to. This increased ability to think about possibilities in the future is not a continual or seamless shift. A young person can at one point demonstrate abstract thinking capacity, and later that same day may not be able to comprehend an abstract idea conceptually. We now understand that the adolescent's brain continues this very rapid and specific development until the age of the early 20s. We also know that people build new brain cells throughout life. So it's just telling you, it's a lot of things that in adolescence that they're not able to process the same way we do as adults. So allowing them to make so many decisions on their own must be balanced. Even with the right information, they can't process it. Psychosocial development. I love this one. Physical and cognitive developments are automatic. That is with no effort at all on the adolescent's part. This growth will happen automatically. Clearly, there are things that can improve healthy growth and development, but generally speaking, bodies will grow and change, and the brain will develop new capacities. Psychosocial development requires interaction with environment in order to happen. There must be active participation on the part of the adolescents. This is the aspect of adolescent development that is about the young person's social and emotional transition from the family or community of origin to a more self-defined status as adult. The developmental tasks that become increasingly important to adolescents include establishing their identity, and that is one separate from their family, becoming independent from their family, defining a sense of personal integrity, practicing new kinds of relationships, and their experience with intimacy. Successful accomplishments of psychosocial tasks of adolescence sets the stage for a productive and healthy experience as an adult. That is so key for those raising teenagers. Go back and highlight it, read it again. Adolescent sexual development continue. Overall, adolescence is a time of egocentric thinking and hyper-focus on self, comparison to others, and a perceived cultural idea. Feelings of attraction are developing and people begin to do relationships. Most adolescents engage in sexual behaviors of some kind. Masturbation is very common during adolescence. Research has demonstrated that for males and females, masturbation as an adolescent can enhance adult sexual satisfaction in later years. Although masturbation is a major sexual outlet during adolescence. Boyce and colleagues in 2003 found that only 32% of grade 11 girls compared with 63% of grade 11 boys approved of masturbation. Many teens, particularly girls, have negative attitudes towards masturbation. By the age of 18, the majority of the young people have had intercourse. By 18. And 20% of those between ages of 14 and 19 who have never had vaginal intercourse reported having giving or receiving oral sex. In the US, the average age of the first penile vaginal intercourse is about 16.5 for males and 17.1 for females. However, not everyone has penile vaginal intercourse, and many people explore with oral sex, partner masturbation, and other forms of sexual expression throughout adolescence and adulthood. In the world, people react to the physical person they encounter and do not base their interactions on an adolescent's cognitive or psychosocial maturity. So if a teen looks 16 at the age of 13, people will treat this young person as if they were 16. This may create challenges and/or opportunities for the teen. Much can be learned by being attentive to how a teen plays up or down this distance between the physical and cognitive and psychosocial development. The teen who is uncomfortable with people assuming they are older will often dress and act younger, while the teen who perceives benefits from people believing that they are older will strive to appear even more mature. Unfortunately, too many teens experience these important and life-changing events and experiences without the benefit of knowledge about what to expect and how to make healthy choices at all. Without access to accurate information about healthy sexuality and risk reduction, young people can experience sexual ignorance that may threaten their sexual well-being well into adulthood. All right, last two sections for this unit. We are doing good, ladies. Sexuality in adulthood. Throughout adulthood, we continue to gain new information about sexuality and our bodies, and perhaps strive to correct misinformation we were given earlier in our life. In North American society, our range of sexual choices and lifestyle are much wider than in earlier generations. Our attitudes and beliefs can sometimes change as we experience more and gain insight through exposure to new and diverse people and things. Having access to accurate information is important to all life stages. In terms of sexuality, it is critical to have some basic knowledge by the time one reaches adulthood. What'd you say?
Oh, I thought.
No, I just keep getting more messages. Somebody's trying to get in the Zoom, and I'm like, wow, you know.
Oh, okay. Sorry.
No, it's okay. Hold on, I know what happened. All right. Thank you. Thank you for your patience. I think I had sent the Maybe Zoom link to somebody else that wasn't supposed to get it? No. All right. Trying to leave no sister behind, okay? Okay, so selecting partners and mates is a central aspect of adult sexuality, as is maintaining relationships, both sexual and non-sexual. Relationship issues that might be possible parts of this developmental stage include remaining single, cohabitation, marriage, divorce, having children, loss of a partner, caretaking for parents, and grandparenting. Recent years have been a sharp increase in the number of single young people choosing to remain single. Among people in their early 20s or singlehood is now the most common lifestyle. Several factors such as pursuing education and career goals contributed to this increased proportion of singles. Some adults may choose an alternate sexual lifestyle to the social norm of being monogamous to one partner. Terms like open relationship and polyamory is the term most often used to describe consensual, non-monogamous relationships. Here are some alternative relationship structures that some adults may find more fulfilling to their sexual selves than traditional monogamy. So you have open marriage. It's based on a view that people's needs for intimacy are unlikely to be satisfied through just one relationship. Swinging is a form of consensual sex in which both partners openly share sexual experiences with other people. Group marriage is where 3 or more people share an intimate relationship without being legally married, and each member feels committed to at least 2 members. So all of these alternative sexual lifestyles require a great deal of communication between members of the relationship. Research has suggested that attitudes towards open relationships or polyamory is the only difference between monogamous and polyamorous couples. Satisfaction levels do not significantly differ. Additionally, it is often thought that couples in polyamorous relationships end up being more satisfied simply as a function of their incredibly high level of communication skills. Very often, a strong part of our identity is connected to our status and these important sexual relationships, such as how we relate to a partner, spouse, parent, or daughter. The context of these relationships is directly connected to the other parts of our lives and behaviors through the stage of adulthood. For example, being single while still in college is different than being single after college or when not in college. The college environment is rich with possibilities for meeting people and having access to potential dates. No other environment compares to the college population in terms of the large number of people who are around the same age with lots of shared interests and free time scheduled together. Another example might include parenthood. Parenting without the benefit of a partner as a single parent is likely to be different in experience than a parent with an actively involved and supportive co-parent. Parenting also helps bond women to other women in ways that may help us to feel close and connected or like we are in this together. This is true for people in other genders too, who are parents. Accessing preventative healthcare screenings and in maintaining healthy behaviors and a positive outlook can lay the foundation for healthy sexuality at all ages during adulthood. Monthly breast and testicular self-exams and other regular checkups, including Pap and prostate tests for cancer screenings, become increasingly important as we age. Given differences in income, employment, and health insurance, not all women and men have equal access to sexual and reproductive health care. As a sexual health promotion professional, you may find it helpful to identify organizations in your community that offer free, low-cost, or sliding scale health services for general health care, gynecological health, breast health care such as mammograms, STIs, and HIV testing, and other health services. That way, if you interact with people who you feel would benefit from connecting with a doctor, nurse, or therapist, you will have a name of an organization, a website, a phone number to give them by helping to connect people with sexual health and reproductive care services. You can play an important role as a sexual health promotion professional in your community. Okay, sexuality in the latter years, and then we're going to look at the interactive activity in the quiz. The fastest growing segment of the population are the people aged between 65 and above. The growing size of this demographic may have a profound effect of our views of older people, especially concerning their sexuality. Health permitting, the primary reason elderly people do not have sex more often is that they lack an available partner. Wow. They want to have sex, but maybe their partner ain't here no more. Generally speaking, continued sexual expression, which can include a variety of sexual behaviors, is encouraged and often enjoyed by people throughout life. Even very old people report still enjoying many aspects of their sexuality, including continued familiarity and comfort with their body, continued sexual interest and response, and a continued need to have relationships, affection, and touch. Of course. To some extent, mainstream American culture desexualizes people as they age. Few people like to think that their parents as enjoying sexual pleasure, and so do not think generally about people that age being sexual either. Sexuality among older people is often mocked as perverted or comical, or seen as cute or adorable. Chances are that few people consider their own erotic experience as cute and adorable. This underscores the idea that may prefer this safe, most childlike description for older people because it minimizes the erotic potential that we view as possible for them. As always, we can learn about our own attitudes about sexuality and aging by raising up images of older people experiencing the full spectrum of sexual expression and paying attention to our emotional reaction. In the book, Clinical Perspectives on Elderly Sexuality by Jennifer Hillman, she emphasizes the importance of the need for all practitioners to possess an understanding of the sexuality issues and needs of this population, particularly due to societal changing demographics. The interesting desire and capacity for sex can certainly continue until the end of a person's life. Also, there are benefits to continued sexual interactions throughout life. Sexual expression in later life provides ample opportunity to emphasize sexual behaviors other than intercourse. As we age, sexual response changes and slows down. Yes, sexual response changes, slows down. We know that some difficulty in achieving and maintaining an erection is a very common problem, which all men experience at some point. However, erectile dysfunction becomes more common as men age. Erections may be less firm and take longer to achieve. Now, women generally experience more difficulty with vaginal lubrication. Excuse me, y'all. Some women experience a heightened sense of their sensuality as they travel through their adult years. So menopause refers to the cessation of menstrual periods and marks the end of fertility for women. Menopause occurs as a result of physiological changes that can take place between the ages of 30 and 60. Around age 40, for most women, the ovaries begin to slow the production of estrogen. This perimenopause stage can be marked by irregular menstrual cycles and erratic, heavy, or absent bleeding. Perimenopause can also last up to 10 years. By the age of 50, many women have stopped menstruating and are said to be in menopause. The experience of menopause and perimenopause varies greatly from woman to woman. For some, it's rather an uneventful period. Others may experience symptoms that can include hot flashes, thinning of the vaginal walls and less lubrication, headaches, memory loss, and decreased ability to concentrate. Now, choosing whether or not to use hormone therapy to create the symptoms of menopause is one of the most complicated health decisions a woman may face. Many women feel relieved that they no longer have to worry about pregnancy, contraception, and menstruation, and may experience a new sense of sexual freedom. Others may grieve the loss of their fertility, even if they had chosen years earlier to no longer become pregnant or have any more children or any at all. It's a change in the life stage. It isn't entirely clear how menopause impacts a woman's sexuality. Though a few things are generally known, menopause is linked with decreased vaginal lubrication and thus more pain during sex. The statement that they said, it isn't entirely clear how menopause impacts a woman's sexuality. Patty Brisbane, which is the founder of Pure Romance, look up Patty Brisbane Foundation, and she has, I believe, 8 different areas of focus that she's focusing on for 2021. And that is one of the areas of focus because enough research has not been done.
Can I ask a question?
Yeah.
Can we say that the perimenopause is the premenopause symptom?
Yes, that
Stage?
is correct.
Okay.
Yep. Vaginal moisturizers can be critical to help women feel greater vaginal comfort as well as greater pleasure during sex. Vaginal lubricants may also be helpful, but are often needed in addition to vaginal moisturizers, not as a replacement for them. Age-related health problems may have a bigger effect on women's sexuality than does menopause itself. So on that note, for vaginal lubricants versus vaginal moisturizers, I would say that is an area to visit and study and research and know when to tell your client or whoever you're talking to speak with their physician. Because if they have an outstanding issue, you may need to know if they need to know if lubricant is what's the only thing that they need. Age-related health problems may have a bigger effect on a woman's sexuality than does menopause itself. Subjective sexual arousal, whether a woman feels aroused or not, and perceptions of genital arousal do not differ between pre- and postmenopausal women. Erotic female-oriented materials can elicit high levels of subjective and genital arousal in all women, regardless of their age and menopausal status. Aging and sexuality are closely linked to individual health and medical conditions that can impact how sexuality is experienced. In fact, overall health may have the biggest impact on sexual functioning in later life. The poor health of a partner may also limit the sexual interactions to the other. Additionally, decreased sexual desire and arousal can often be side effects from some medications that are common later in life. A willingness to experiment with variations for sexual expression, including perhaps oral sex, masturbation, fantasy, and sexual enhancement products can keep sexual satisfaction levels high throughout life. In your work as a sexual health professional, you will likely have ample opportunities to reassure women of all ages of the value and worth of their experiences. You will be in position to reassure people that it is normal to desire sexual intimacy and expression throughout their lives, and is not just when they are very young or when they have firm bodies. Sexual intimacy may be treasured by women and men regardless of their age, body or size, or number of wrinkles on their forehead. Although there are certainly many body-related changes that can affect the ease that which people experience their sexuality, there are still many possibilities for connection and enjoyment. So you have reference materials and great book references here. So as you have more things that you want to study or look into more, I love how they always give us really good references. Interactive activity. So the activity that they had us doing, make sure you plug it in this section where it says interactive activity, opposed to, yeah, they put it in the front part. Okay, it's okay. Remember when we first started and it had under unit 2, it had sexuality, a lifelong process, and it shows like activity 1. It was just sampling that for you, but you're going to do activity 1 under the interactive activities and make sure that you're listing those 3 things. Okay, we're going to go ahead to the quiz. All right, we still have 10 participants. Thank you, thank you. Not the 18 that we had Monday, but I know that there was some other things going on tonight too. I read in the chat. And sending well wishes to everyone. Number 1, in order for people to be considered sexual, they usually have to be having sex. Is that true or false?
False.
False.
Right. That is false. By the age 18, most people have not had intercourse.
Oh,
In the US.
Oh,
All right, false. The way American culture tends to view sexuality among older adults tends to minimize their sexuality or erotic potential. True or false?
True.
true.
Yeah, that's very true. Orgasmic experiences are the same for male infants as they are for male adults. Is it the same or is it similar?
It's similar, so that's false.
Yeah. Good job. Menstruation, nocturnal emissions, and the shift from concrete thinking to abstract thinking categorizes which stage of development? Is it pre-adolescence, adolescence, post-adolescence, or adulthood?
adolescent.
Pre-adolescence.
Yeah.
Which one?
Adolescence.
Adolescence.
Yep. Adolescence psychosocial development is characterized by what? Is it the adolescence establishing his or her identity separate from the family, becoming dependent on their family, disengaging from relationships, or all of the above characterize adolescent psychosocial development?
All of the
Adolescence.
Don't let it trick you. Somebody was saying,
All
was
of
that
the
you?
above?
the adolescent establishing his or her identity.
Separate from the family. Yeah, that's what I chose.
So the adolescence establishing
first one.
his or her identity separate from the
From the
family.
family.
That is correct, because they're not becoming dependent on their family. That's
Right.
not what they're changing over into. They're not learning to disengage from relationships with peers. So we wouldn't want those to be a part of the psychosocial development. Okay. 7, at what age do female babies begin to exhibit vaginal lubrication?
Shortly after birth, 4
Okay.
months. It was 4 months.
Yep, shortly after birth. When a baby is born and we begin to treat the child as a boy or girl by buying them gender-specific clothing, this is an example of what? Gender socialization, sex roles, sexualization, or sexual revolution.
Gender socialization.
Yes. The key thing that we learned even Monday when we were talking about those definitions, anytime it's gender, think about it as what society's norms are, how you should respond. It's like they almost like go hand in hand. Masturbation in children tend to start between what ages? 6 and 12 months, 18, 24 months, 30 and 36 months, 5 and 6 years old.
5 and 6 years old.
5 and 6.
5 and 6.
Masturbation start real early.
18 and 24.
6 to 12.
Think about them diapers, 6 and 12 months. They start early, y'all. They start early.
Wow.
Yeah, 6 to 12 months. I don't know if any of you all have changed diapers of little boys. Sometimes they'll pull their stuff through the side of the diaper. Yeah, but different things.
Start experiencing themselves.
Yep, yep. And so when they experience it, some like it more than others. So some be like, oh, let me get back at that. I mean, I use boys for an example, but it is not just males. It's children.
Yeah. And
Yep.
it doesn't stop there.
No. So 10, we said sex games like Show Me Yours and Playing Doctor become more common between the ages of what? Is it 2 and 3, 5 and 8, 6 and 10, or 12 and older?
6 and 10.
Mm-hmm. Who played that game? All right, 11, same gender sexual play in childhood is a sign that a child will grow up gay or lesbian, is much more common in boys than girls, is much more common in girls. Well, I said wrong. Okay, is much more common in boys than girls, or is much more common in girls than boys, or does not predict sexual orientation.
4.
Not predict sexual orientation.
Mhm. It doesn't. That's a myth, and it's actually, homophobic or bias. Okay, 12. Most often, children have a sense of whether they are boy or girl by the age of 1, 2, 2, 3, 5, 6, 8, or 9.
2 to 3.
2 to 3.
2 to
Yep.
3.
All right. And what is the reason that Swedish children tend to have more accurate knowledge of genital differences and proper names for genitals than children of other countries? Is it parent ability? Is it comprehensive sex education since kindergarten? Is it abstinence only sex education since kindergarten? Or is it increased knowledge in school teachers?
2.
2.
B, C, probably 2.
So comprehensive sex education since kindergarten. So if you all have children, that you can understand that knowing the name of the genitals, having those healthy conversations, and giving them good sexual health education actually made these children be a little more confident, more successful with their process. 14, what is polyamory? Is it one man married to more than one woman at a time? Is it a term used to describe non-monogamous or open relationships? Is it a sexual position used most often in married couples? Is it the view that infidelity should be accepted?
Non-monogamous or open relationship.
The second
Yes.
one.
It's just a term used to describe a non-monogamous or open relationship. All right, last but not least, hot flashes, thinning of the vaginal walls, less lubrication, headaches, memory loss, decreased ability to concentrate, or all symptoms which could categorize menstruation and PMS,
Premenopause, no,
contraception,
menopause.
hormone, right,
Perimenopause
perimenopause
and
and menopause, or all the above. Perimenopause and menopause. We want to click submit my answer and look at there, ladies. We are doing great. We have them all correct.
this is very informative.
Yay. All right, so just wanted you all to verify that all of these are correct. Well, no worries. All right, we are done. Are there any questions?
Not right now.
Yeah.
No? Okay. So how are you all doing with, I guess
I have a
getting,
question.
oh, go ahead with the question first. Mhm.
Where did you purchase the vulva puppet from?
Okay, so I purchased from Etsy, Wondrous Puppet.
Okay.
However, there is a pillow on Etsy. So I'm gonna tell you the difference. The puppet is what it says it is. It's a puppet. You can put your hand in it and work it. It is great for in-person learning tool because you can actually put your hand in it. It has the depth, you know, when you're showing the vaginal walls. It has texture for the G-spot, but it's pushed up. So when you say put your fingers in and feel that, it actually has something there for them to feel. It highlights the urethra here, so you'll know the difference between that and the clitoris and how they're closely in space. So I like the puppet. It is a little costly for Miss Goldie. But there is a pillow that is a little bit similar where you can just still point out certain parts, but it is not as interactive, meaning that you can't show the G-spot and vaginal walls, because this has some depth to it and, you know, a little bit different. Yeah. Very well made, and people like her a lot. And she comes in like a pretty satchel like this.
And what is it called again?
Wondrous Puppet.
Wondrous Puppet. Thank you.
Look up the lady who invented it on YouTube. Her name is Dorie Lane. I think like Dorrie. She has a very unique story, and she started out making a puppet for her child, her daughter.
Thank you. Okay.
Yeah. But she has a few videos on there, but she definitely has one that tells her story and her inspiration behind creating a puppet. And her passion was similar to Patty Brisbane and some other women, where they're like, there's just not enough information. How do you share this? What do we do? And she just got creative with it. But she started out making a puppet for her daughter so she could show her and explain stuff real good.
So do she sell that puppet?
Yes. So this particular one, and now she has a whole stack of all different ones. You can get it with
different colors as well. Yeah, looking at her now.
Yeah. So these are different prints that she has and designs, beads and pearls on them. You can get it all. And it's called the Wondrous Puppet. Wondrous Vulva Puppet. And you can buy it directly from her website or Etsy. But it looks like she just is not like somebody else selling her puppet on Etsy. It is her. You know, it's her stuff in there. You can buy it on her website or on Etsy. She don't care. I was asking how you ladies were doing with, are you doing the quiz as you go along? Are you getting off and getting back on and having to get back to it? How is this working out? Just,
Doing it
I
as
have
I
to
go along.
hop
It's
off
making
and
out
on
good
again.
for me. I just want to know, do we have to do the interactive activity even if we do if we follow along with you and do the quiz, do we still have to do the interactive activity?
you have to do the interactive activities.
Okay.
It's
Okay.
not gonna let you, get your certificate mailed out.
Okay.
Yeah.
I hop off and hop on because I have a phone.
Okay.
I
What
just
if we
try to
finish the
multitask.
quiz? Oh, sorry.
Okay, go ahead.
No, I'm sorry, go ahead.
What if we finish the quiz, save it, and then come back to the activities? Is our quiz still saved, like, for real?
Yeah, you want to hit save.
Okay, yeah, I did that. Okay, cool.
Yep.
That's why I was gonna get back to my activities.
So like you can skip around and come back to it or whichever, just long as you're clicking save and come and then hitting submit once you have everything entered. And then it'll be there. And then if you go through your dashboard will show you what quizzes you have completed versus what activities you have completed.
Cool.
Yep, you click on dashboard at the top by your name in that university website. And then you're gonna hit progress and more. And that'll open up. It'll have like a drop down. And that's how you're gonna keep up with what you need to do. Yep. All righty, I got another class. I have literally been in Zoom all day.
Oh.
Thank
Yes.
you.
Thank you. I'm gonna go ahead and set this up so that it's uploading like before. It takes a minute. And then I never did a Zoom back to back. I gotta see if it's gonna upload and I'll be able to do another Zoom. I think I can. So I'm gonna let this upload and then I got a discussion in my VIP group on masturbation.
You got this, you got this.
Yes. Look, I got my phone blowing up now. They're like, it's 9 o'clock. Where are you? I'm coming. But thank you. I
Thank
love
you.
it. And y'all still follow along. So anytime that we need any assistance through this process or fill-ins here and there, yes, I might need to call on you ladies. So yep. Thank you so much. And you all have a
Have
great
a good
night.
night.
All right, bye-bye.
Thank you as well.